we all agree that this is a collective challenge, and you've asked us to trust, and we have. I think we have seen it, place trust, collective trust in the government, in the ministers, in our public services. But part of that trust must be a mutual trust, that the government will trust in members of the opposition, members of other parties, all of whom share the common goal of the public good and of public health at this time, and really engage and listen to the proposals that are put forward. To trust that all those who are elected here and who are bringing forward ideas are doing so in good faith and with good intention, not for their personal or political success, but for the good of the country. Trust is one of the most powerful currencies we have at this time, and that common consideration which comes from it and flows from it. And in regard to that trust, I would urge as well that the government, who I think have been very good in giving clear information in the early stages of this process and taking some very robust and responsible actions, that same clear and forthright communication would continue and would be increased. I know that many of us have written to ministers seeking answers on issues. I know that they are overwhelmed, but it's important that we can get those answers to pass on to others, to keep social trust in place. It's also very important that, for example, in relation to PPE, we saw a real concern where there was a question of people being able to identify the problem and identify the lack of essential protection for those who protect us and those in our hospitals. And we have to make sure that we never seek to silence or obscure those voices, but that we listen to them, and that listening is very palpable and heard. I think we're all extraordinarily proud of the work that Michael Ryan has done in the World Health Organization. And we've heard many people quoting the fact that he said, speed sometimes trumps perfection. But the other thing that he has told us, and he said it just in the last 2 days, is that human rights, privacy rights, human dignity, that those are also important considerations, that they must also be factored, that we cannot put them aside in pursuit of our public health, because part of public health depends on respect for that rights-based approach to health. And that was something that was echoed by a number of UN rapporteurs in a letter that they published yesterday, where they spoke about ensuring that the public health response supports all the public, including the most vulnerable, those with disabilities, those who are homeless, those who are migrants, those who are refugees. That is part of our public health response. It's not something we add in later, it's how we do it. And in that regard, Minister, there have been requests to move the vulnerable out of direct provision centres. We cannot simply allow for persons to be moved out to intensive care units or to hospitals because we did not take the opportunity to put protection in place and to ensure safety. And we also need to look at moving the vulnerable in terms of those who are homeless in Ireland. We need to ensure they have a safe place to be during this crisis.